The problem of occupational disease is so important and so often overlooked. Every year in April, we commemorate Workers' Memorial Day, and we honor and describe the tragic loss of over 4,000 men and women from accidents and injuries on the job. And that's really important. But that number shouldn't allow us to forget that 40,000 people, according to US OSHA, die every year from occupational illnesses. They don't die because they fall off a ladder. They don't die in the same visible way. They die at home or in the hospital, but they're dying because of what happened on the job. The regulation of occupational exposures to chemicals is almost non-existent. So we have 85,000 chemicals on the market. US OSHA has set limits on a few dozen of that 85,000, and the limits that they set were mostly done in the 1970s, in the first vibrant years of OSHA based on 1950 science. So at the end of making a tire, you have to put the rim in. And the tire would come down the line, and the women workers, men workers too, but mostly women, would have an open vat of a known human carcinogen. And they'd dip a little hand mop into that open vat, and they'd wipe the inside of the tire and then pop the rim in. And it shouldn't surprise us that there was a high rate of leukemia in those workers. Over time, they figured out that the only thing that the carcinogen was doing was wetting the inside of the tire, and that if they used an open bucket of warm water with a little bit of Dawn detergent in it, it worked even better than using the vat of carcinogen. So that's what the job is now, and stunningly, the cancer rates have gone down. Leo Gerard, the head of the United Steelworkers and one of the founders of the BlueGreen Alliance, likes to say that it's never a choice between a clean environment and good jobs. It's both or neither. And that principle is what the BlueGreen Alliance is based on. It's a coalition of labor unions and environmental organizations that really first came together around the issue of climate change and wanting to find solutions to climate change that expanded the number of middle-class family-supporting jobs in the United States. The Putting Breast Cancer Out of Work and the training that we do to train workers to engage their employers in looking for safer chemicals is also part of the way we think about our role in this larger project on building a cancer-free economy. The way we get to build a cancer-free economy is we recognize the role of chemicals in the cancer-full economy, and we look for the opportunities to retool manufacturing, to retool products, to retool practices, to move from those cancer-related chemicals to safer alternatives. You know, we used to use a carcinogen to decaffeinate coffee, but only a little bit of that carcinogen was left in the coffee at the end of the process, just a little bit. But now they decaffeinate coffee by putting hot water through it, or carbon dioxide, two very safe ways to decaffeinate coffee, where you don't have to worry if a little bit of water or a little bit of carbon dioxide is left in your decaf. And how many more ways, if we ask the right questions and we insist on information, not ignorance, can we actually put people to work making products and practicing in ways that are just inherently less toxic and safer for everybody, safer for fish, safer for pandas and safer for people.